Hello and welcome. My name is Aimee Giglio, and I'm the Chief Human Resources Officer for Dartmouth-Hitchcock Health. And for today's update, I'm joined by Dr. Robert Brady, our Director of the Anxiety Disorders Service at Dartmouth-Hitchcock. I think we're in a very trying time right now, and there's a lot of anxiety among both our employees as well as our community, and we thought it'd be good just to ask you a few questions about what people can do during this time. So, welcome.
Thanks, Aimee. I think the first thing for folks to know is that anxiety is not dangerous and it's not wrong. And this is the time when anxiety makes a lot of sense. Anxiety is an emotional response to a perceived future threat somewhere in the distance, somewhere in the future in time. And what we're dealing with right now is really appropriate for that sort of anxiety response. What we do know, however, is that sometimes anxiety becomes excessive. We know it's excessive when it starts causing problems and getting in the way of people's day-to-day life, or when worry starts to become seemingly uncontrollable. And then we actually do have some ways to try to manage that sort of thing.
So given the stressful time that we're in right now, what would be some examples of ways people could cope with anxiety?
Sure. So there are several. One thing is controlling the amount of information flow that people are exposed to. So we live in a great world with a lot of technology where we get a lot of this. But if that's all you're experiencing all day long, this nonstop flow of news, then it can start to feel overwhelming. So one of the things I've encouraged folks to do, especially if you're the type who says, I need to know every new headline, every new update, is you can do a little experiment. You can watch the news as you normally would throughout the day, start in the morning, end at the end of the day, however you prefer to do that, and then look back at the end of that day and ask yourself what came up in those news headlines that really changed your action, changed your behavior, and ask yourself how much of that was really necessary. How much could I have not simply gotten at the end of the day in that 30-minute evening news broadcast? So that's one strategy. Another one during this time, and really oftentimes with anxiety, is to accept the uncertainty. It's an uncertain time, and uncertainty is not dangerous. And I oftentimes will challenge my own patients to ask, how many things do you accept when it comes to uncertainty during the day? And when people look back, they actually accept a lot of things that they don't know for certain, and that can be a real source of peace, to accept and know that not everything has to be 100% certain in your life. And then lastly, if people are starting to experience worry that seems out of control or unmanageable, we want to start putting some constraints around that. We want to kind of hold it in. So what I will talk to people about is what we call a worry period. We can take all of those worries that come up during the day, jot them down, take a little piece of paper, write them down, and then find 20 or 30 minutes during the day when you can sit in some location in your home. I always say, make it your least comfortable seat. And then for that 20 or 30 minute period of time, that's your worry period. That's your time to do as much of the worrying as you want to do or you think you can do in that period of time. If at the end of 30 minutes or 20 minutes even, you find that you're running out of things to worry about, that's okay. Your worrying's done for that period of time. Tomorrow, scale it back a few minutes. Take it back 5 minutes, and that's your new worry period. And what you start to do is put some boundaries around that worry process and that worry behavior, and start to feel a little bit more in control of that experience.
Interesting. So a lot of self-reflection sounds like, in terms of how to cope with that. I know from an anxiety perspective, we often hear that people have trouble sleeping and their sleep is interrupted because of some of their thoughts. What are some ways you can cope with that?
Right. Well, and it's not just thoughts. It's also the sleep behaviors. So when we're in a period of time like this and so many people are staying at home, our usual sleep behaviors can easily get out of whack. I know I've been guilty of that at times as well. People may fall into the nap trap at home where you're working from home. It's really easy to squeeze in that nap when you get tired. Unfortunately, that makes you have less of an urge for sleep later in the evening when you really want to go to sleep. Additionally, if you change that onset of sleep when you decide to go to bed and when you wake up, there's strength and regularity when it comes to sleep, and we want to start putting those boundaries back in place and not falling victim to changing that. And then lastly, if a person is finding that they're doing a lot of dwelling and ruminating at night, they're they're not falling asleep quickly within 20, 30 minutes, what I encourage folks to do is, if you haven't fallen asleep in about 30 minutes, gently get out of bed, go to a quiet place in the home, do a quiet activity, reading a book or a magazine is a great option, and do that until that urge for sleep starts to come back. Gently get up, walk back to the bed, see if that urge continues and allows yourself to go back to sleep. You can do that a couple times, you can do that several times in a night, and that'll help to make sleep more regular.
That's great. Now, during this time, you mentioned people being at home, and I know a lot of people are working from home or they're social distancing at this time given the COVID-19 crisis that we're in. Question about being isolative and how that contributes, and what are your thoughts on that?
Sure. Well, so psychologists and other mental health professionals have known for a long time that when your daily routines change or they decrease in the pleasurable and important parts of your life, including socialization, that this can put people at risk for worsening of mood or even depression. So one of the things that I've encouraged folks to do, not just when it comes to social isolation, but in other areas as well, is reflect on what really matters to you. What are the values you have when it comes to socialization? What's important to you about being a friend or a family member? And then say, what would I normally do to honor those values? What would be the things I would typically do consistent with what matters to me? And now in this current situation, how can I adapt some of those usual behaviors in this new setting? So if I care about being an attentive spouse, or I care about being a good friend, are there ways that I can be that good friend using technology if it's available, or maybe even just sending a text to someone, letting them know that I'm thinking about them? This is a way of keeping up with the regular part of my life, the things that really matter, but adapting it to the situation. I believe in people, and I believe in our patients here at Dartmouth-Hitchcock and our community, and I believe in our ability to be creative and adapt to these sorts of situations.
So Dr. Brady, I know there's a lot of balancing going on in people's lives. They've got children at home, they've got schoolwork now that they're doing that they probably weren't doing before. How do you suggest, or any tips to give parents during this time to manage the work-life balance?
Yeah, you're absolutely right. The circumstances have changed, and the responsibilities have changed in some ways, at least, who's providing them and when. So what I would suggest to folks is make a list. It doesn't take very long, even though it feels like it's going to take time away. But make a list. What are my responsibilities? What are some new responsibilities? And then write out, what are the time schedules that I want to try to attend to these various things? And just like you would do in your regular job where you have responsibilities, you just have some new tasks that you've been asked to do. Except now the people asking you to do the tasks are like this tall instead of this tall.
Given what I've asked you today, is there anything that I haven't put out there that you really wanted to share with our community?
Absolutely. One of the things that I want to remind folks of is if they're already under the care of a mental health professional, I encourage them to reach out to that individual in the event that they experience a change or worsening in their mental health. So many of our professionals, psychologists, therapists, psychiatrists are providing these services using technology, and they really would benefit from reaching out to those folks as needed. Additionally, the American Psychological Association as well as the Anxiety and Depression Association of America have both provided publicly available materials on their websites to help people cope with the stress and the anxiety that accompanies this current situation.
Thank you, Dr. Brady, for your time. That was great. And thank you. We'll be back next time.